Okay, this chapter is fairly long, so you're going to want to take breaks and review. It's really important, though, because it does talk about your treatments for a lot of your psychological disorders. So please make sure to pay attention and to your course outline, but also to, excuse me, to your course objectives as well. So please make sure to go back through and look these over and get familiar. One of the things that we're going to talk about is your pharmacological treatments of your mental disturbances as they're directed at certain neurotransmitter receptor problems. Like antipsychotic drugs, they're used to decrease dopamine. Your antidepressant drugs increase the synaptic levels of norepinephrine and or your serotonin levels. Anti-anxiety drugs are going to increase the effectiveness of your GABA or increase your 5-HT and or your norepinephrine. So you want to make sure you pay attention there. So all actions of the brain, your sensory, motor, and intellectual, are carried out by what we call physiological interactions with nerve cells, and the interactions involve impulse conductions, neurotransmitters, and can lead to mental health disturbances and manifestations if they're of any type of physical manifestations or disturbances. If something happens in if there's an alteration. In particular, sometimes excess activity of dopamine is involved in thought disturbances with patients with schizophrenia, and deficiencies of norepinephrine, serotonin, or both underlies depression and anxiety. So insufficient activity of GABA is also going to play a role in anxiety in patients. Unfortunately, agents used to treat mental disease can cause a lot of undesired side effects. Prominent among these are sedation or excitement, motor disturbances, muscarinic blockage, alpha antagonism, sexual dysfunction, and weight gain. So there's a lot of continuing effort to develop some types of new drugs that are more effective, safe, and more tolerated in our patients. Nerve cells that respond to stimuli, conduct electrical impulses, and release chemicals are part of the composition of the brain on the cellular level. Then you're going to have neurotransmitters. You're going to have receptors that allow activity of one neuron to influence the activity of another neuron. And this is where your drugs are going to target to treat your psychiatric diseases. Look at Table 3.1 on page 41 through 42, and it talks about the different transmitters and the receptors and the effects that they have on each other, and then some of the associated mental health illnesses that go with it. And this is a very, very helpful table, and it's Table 3.1. It starts on page 141 and goes through page 142. Again, on the cellular composition of the brain, lots of times just parts of the brain or your neurons or your transmitter are destroyed by specific enzymes at the postsynaptic site, or the reuptake is also involved. Reuptake is when a neurotransmitter is taken back into the presynaptic cell where it was originally released, and it's either destroyed or reused by intracellular enzymes, so it never goes forward. So you have your presynaptic neuron, your synapse, and your postsynaptic neuron, but it never makes it past that site, so it's taken back into the presynaptic neuron. So if you, and this can destroy the transmission. So look at this YouTube video also connected on here, so for you to look at, and I think it will help you to explain better for you. Neurotransmitters. These types of neurotransmitters have excitatory effects on the neuron, and they can increase the likelihood that the neuron will fire an actual potential. Some of the major excitatory transmitters include your epinephrine and norepinephrine. These types of neurotransmitters that have inhibitory effects on the neuron, they're going to decrease the likelihood that the neuron will fire an action potential. And so some of the major inhibitory transmitters include your serotonin and your GABA. So you might want to start making notes here about your excitatory transmitters and your inhibitory transmitters. And again, you have WebSpace, which actually gives you some information about your neurotransmitters, and it can be very helpful. And here's another neurotransmitter cheat sheet for you. Here's a comparison of drug actions. Here's your agonistic drug effects and your antagonistic drug effects. Here's a list of psychotropic drugs that affect cognitive function, emotions, and behaviors. And you have your list here. Many of these I'm just going to have information posted for you instead of me just talking it through the whole way. So please, when you just see the slide, please review and read over that, and that way you don't have to hear me talk so much. Your anti-anxiety and hypnotic drugs, it enhances the ability of GABA to inhibit neurons that cause excitability. For general anxiety disorders, and it's also used for panic disorders. Other uses can be used for seizure disorders, insomnia, muscle spasms, alcohol withdrawal, induction of anesthesia. These can also interfere with motor ability, attention, and judgment. These are also known as your Z drugs. No anxiety, anticonvulsant, or muscle relaxant effects as your benzodiazepines. And usually these are taken when someone is ready to go to sleep and they have a quick onset. Here's some more melatonin, which is more of your herbal and natural effects. And then you have your melatonin receptor agonist that are listed here. Your Rosarin regulates circadian rhythms, but side effects are headache and dizziness, and long-term use can actually increase your prolactin levels. Cellular, this is for people with difficulty maintaining sleep, and however, people with this should avoid any of your CNS depressants and antihistamines. Those on Whiteboard, take this to reduce anxiety with no sedative effects. Your antidepressant drugs listed here, they block the muscarinic receptors, which can lead to anticholinergic effects. And those anticholinergic effects would be blurred vision, dry mouth, tachycardia, urinary retention, and constipation. These drugs can lead to apathy and low libido, and may cause nausea and vomiting and GI side effects. Your Paxil, it's not good to take this with because of the anticholinergic effects and agents. Please look at the YouTube video that's posted here. Also, too, with any kind of antidepressants, and these are also your SSRIs, which are your selective serotonin reuptake inhibitors. And you're going to hear a lot about SSRIs. You want to be careful and make sure that someone is weaned off slowly. You cannot just stop taking these medications. And some of these meds can take 2 to 4 weeks to actually get into the system to take effect. These are the SNRIs, which are serotonin norepinephrine reuptake inhibitors. These are taken for depression and for GAD, which is your anxiety. and diabetic peripheral neuropathy, and also people with fibromyalgia. It limits pain signals to the brain. Your SNDI serotonin norepinephrine disinhibitors. This is Remeron. It's an anti-anxiety and antidepressant effects. It also improves sleep and minimal sexual dysfunction, and has antiemetic effects as well. Most common side effect with this, though, is weight gain and sedation. As you can see, there are a lot of antidepressant drugs, and depending on the serotonin and what the issue is at the time, if you need an inhibitor or reuptake, non-inhibitor. So again, you want to pay close attention to all those. Also, the other thing is you have monoamine oxidase inhibitors, which are your MAOIs, and I know you've seen these in the side of boxes and medications. Many of your MAOI inhibitors will block the MAOA in the brain and increases the amount of norepinephrine, dopamine, and serotonin that's available for transmission of impulses. So increased amount of those neurotransmitters at nerve endings are going to intensify responses and relieve depression. Here you have some of the listed uses for these and some of the medications. However, with MAOIs, you want to stay away from tyramines because this can lead to hypertension. This would be something like aged cheeses, wine, smoked or pickled fish, if you would like that. And it can cause vasoconstriction if eaten while taking this type of classification of drug. You want to give the patients a list of the foods to avoid because they can also risk toxicity for patients with liver dysfunction as well. So MAOIs, if used with SSRIs, it can lead to serotonin syndrome. And serotonin syndrome can occur when you take certain combinations of prescription medications that affect the serotonin levels in your body. For example, serotonin syndrome can occur if you take selective serotonin reuptake inhibitors. And remember, those are called SSRIs. Or you take serotonin and norepinephrine reuptake inhibitors, such as your SNRIs, for depression, along with triptan medications to treat migraines. The serotonin syndrome can also occur if you take SSRIs with other drugs or supplements that affect serotonin levels, such as St. John's wort. That's why it's so important that we talk to our patients about any medications, over the medications, and any kind of herbal meds that they may be taking as well. Signs and symptoms of the serotonin syndrome range from restlessness and rapid heartbeat to muscle rigidity and seizures. These do go away quickly with treatment, which may include discontinuing the medications that are causing the symptoms with taking other drugs such as muscle relaxants or serotonin production blocking agents. However, if not treated quickly, the serotonin syndrome can become life-threatening. We'll see at this level, then, it would be extreme agitation or restlessness, confusion, hallucinations, loss of coordination, fast heartbeat, rapid changes in blood pressure, fever, heavy sweating, overactive reflexes, nausea, vomiting, diarrhea, seizures, and coma. Some other antidepressant drugs, one of them is Wellbutrin. It's used for smoking cessation. It has no sexual side effects. Side effects can include insomnia, tremor, anorexia, and weight loss. It is contraindicated for patients with seizures with current or prior diagnosis of anorexia or bulimia, or abrupt cessation of alcohol or sedatives could cause seizures. Your Viagra, this has side effects of nausea, vomiting, and diarrhea, and insomnia. It's better if taken with food for bioavailability, but don't take it at nighttime because it can cause insomnia. Trazodone is also used to treat insomnia. The side effects are sedation and orthohypotension. Extended release is given for those who have major depressive disorders. Here we have mood stabilizers, and you'll see these listed here, and also anticonvulsant drugs. Lamictal is used for depression with bipolar disease, and side effects of this is rash and St. Johnson disease, which minimized by slow titration to therapeutic doses. So make sure you use this medication very slowly and not to overdo it too soon. Another one of the mood stabilizers is lithium, and it can interfere with regulating fluid balance. It can cause polyuria and edema. It also is used to reduce mood swings and used in bipolar disorders. Depakote, some of the side effects you'll see with it is tremors, weight gain, sedation, severe thrombocytopenia, pancreatitis, hepatic failure, and birth defects. You need to make sure you have baseline levels, liver function tests, and your CBC, and therapeutic blood levels need to be monitored. Another drug is Tegretol, and it helps to prevent mania, especially in those who have bipolar disease. Side effects are anticholinergic effects. Remember that all that drying effects, orthostasis, ataxia. Life-threatening is exfoliating dermatitis and St. Johnson syndrome. Your antipsychotic drugs, you have different generations, and some of these are used for symptoms of schizophrenia. Antagonism is responsible for some of the major side effects. So you want to monitor for involuntary movements, such as what's known as abnormal involuntary movement scale is used. It's known as AIMS, and so you would have a scale that you would use a form, or it would be on a computer. It inhibits the release of prolactin and can cause amenorrhea, galactorrhea, and gynecomastia in men as well.
All ready? For what?
Some of your conventional first-generation antipsychotic drugs, antagonistic receptors are used for acetylcholine, norepinephrine, and histamine. For the acetylcholine, what it'll do is block muscarinic receptors, such as, so your side effects would be something like blurred vision, dry mouth, constipation, urinary hesitancy, and impaired memory. Norepinephrine, it brings about vasodilation, and then the histamine, the side effect would be sedation and weight gain. With the second generation, these are some of your atypical antipsychotic drugs. They're going to produce fewer your EPS, your extrapyramidal side effects. It does target both the negative and positive symptoms. It's often chosen as a first line of treatment and can cause your metabolic syndrome and increase in weight, blood glucose, and triglycerides. Serotonin can cause movement side effects and worsen cognitive and negative symptoms of schizophrenia, and can increase the hormone prolactin as well. Here's some of the drugs. Chlorazeril can suppress, suppress bone marrow and induce agranulocytosis, which is a reduction in white blood cells. So these need to be monitored. They can also induce convulsions, cause drowsiness, hypersalivation, sedation, and does cause a potential of myocarditis, weight gain, reflex tachycardia, dizziness, and constipation. Risperidone may increase prolactin orthostatic hypotension, and sedation. Also weight gain, sedation, and sexual dysfunction. Seroquel can actually cause weight gain, moderate risk for your metabolic syndrome, and orthostasis. For these drugs, I want you to look at page 61 in your textbook. Your third generation antipsychotic drugs such as Abilify are dopamine stabilizers. So they lower dopamine in areas where there is excess. But some of the side effects can be insomnia or akathisia. Some other drugs that can be used for ADHD, for those who have short attention span, impulsivity, and overactivity. But the side effects can be agitation, hypertension, growth suppression. It can exacerbate psychotic thought processes, potential for abuse. Ages 6 and over will see a decrease in appetite, weight loss, fatigue, and dizziness. It is contraindicated for those with severe cardiovascular disease because it will potentiate increased blood pressure and heart rate. Guanfacine and clonidine are used in ages 6 to 17. It increases. You need to increase doses slowly and do not discontinue abruptly. Side effects for these are on page 62 in your textbook. These drugs, they're used for Alzheimer's disease. You can see them Cognex, Aricept, Exelon, and so forth. They slow the rate of memory loss and can help to improve memory, but it is not a cure for this disease. We do have some herbal medications, and there are some major concerns because of potential long-term effects. This can be nerve damage, kidney damage, and liver. The possibility of adverse chemical reactions with other substances or with conventional medications, and it can potentiate or decrease the effects of your medications.